Why don't we get started? Seems like the people coming on have slowed down, and I want to respect everybody's time tonight. And so wanted to welcome all of you to our third live event here, Doc Rob Live, in which I'm going to try to answer your questions as best I can. And the format for tonight is where we'll start. I'm going to pull up the slides in just a second, but we'll do some housekeeping first, tell you what the kind of the rules and guidelines are. Haley, we have a discount code as well that we're going to um, offer them at the end, won't we?
Mhm. Absolutely. I'll put it in the chat at the end.
And Haley is my is the magician behind the curtain, pulling all the levers and helping making this work better. So we want to thank Haley for that. And I guess I've got a few more on there. Let me let me share these these slides, and we can kind of get started with housekeeping as well. Can everyone see these okay? Let's see, how do I go? Are they full screen right now? Does it look full screen?
Not totally full screen, but we could still see it.
No, it's got to be bigger.
Mm,
There we go. Alrighty. Better, right?
yeah.
Okay, good. Alrighty. So, so welcome tonight. We have some questions from email that we're going to use, and then we also encourage you to have questions that either that you brought with you or which are stimulated by this conversation that we're going to have. You can put your questions into the chat. That's how, and Haley will harvest the questions and read them out. If something I'm saying or something I'm explaining just is absolutely confusing to you, and you feel like maybe we need to clarify that before we move on, then there's a way that you can raise your hand. In fact, I think you can kind of do this. Doesn't that make you raise your hand like this? Where is the I don't see the reactions.
Yeah, do you
Usually,
have the reactions enabled? Maybe I can do that. Recognize hand gestures. I think it
okay,
should.
yeah. So raise your hand or have a reaction so that we can be aware that you have a burning question that you need to answer. It seems like there's a lot more people joining, which is great. We're going to try to do as many questions as we can, as possible. I tend to sometimes go into maybe more detail than I should with some of these. And we like to, if we have the same question asked by multiple people, obviously that's a question that's important for us to answer. Raise your hand, like we said, or make that hand gesture. And I want to be able to help everybody, but I'm limited in my ability to give the perfect answer to your question by the lack of us having a doctor-patient relationship. I'm not examining your pet, I'm not in the same room as your pet, and I don't have all that diagnostic information to help me to give an exact answer that would be perfect for your pet, but it would be good for the general condition that we're discussing around your pet. And so understand that these are my limitations inherent in this platform, and I'll do my best. And we may need to follow up just personally with an email conversation, and I'm very available to you by email. So please reach out. And Haley, can you make sure to have an email address for me available at the end when we also give out the discount code?
Abs-
And what we'll probably do is, because we don't want to have the discount code on the recording, because the recording is going to live on for a long period of time, and the discount code is limited in terms of its time limitation. So we'll wait until we stop the recording to give you that code. If people want to leave early, we can also send you the code by email. We can also stop the recording, give you the code, and start the recording again. We've got a lot of options available. So today's topic is going to be anxiety. And anxiety is one of the chapters in my book, and it's the only chapter actually in which I discuss cat anxiety and dog anxiety in the same chapter. Most of the other chapters really are focused on dogs, although applicable to cats. It just was overwhelming for me to write a book that would have comprehensive information on both. Maybe that'll be the second edition. We plan on continuing these. They're very successful. People are enjoying them. They're learning from them. I think it's a good event. We're actually thinking about adding a second hour a month, or maybe an hour every other month. We'll see how the interest is in that, in which I would do more of a teaching hour. I would do like a webinar on some topic that's of interest to everybody, maybe for 20 or 30 minutes, not keep it too technical, and then allow the last 30 minutes or so for discussion and questions and things like that. And then what we would want to do is have the Q&A, this Doc Rob Live that follows it. We could also use that as an opportunity to discuss more that specific topic. If you think, let us know your thoughts about this, because obviously we want to do something that's going to be popular for people and helpful and useful as well. But it's something we're considering, because there does seem to be a lot of interest in this kind of a live format. Um, these are being recorded live. We apologize to you. We screwed up last week and weren't able to record the video. We're doing that this week. We recorded the Firefly AI transcription and summary, and we have that available to you. This week, we can't figure out how to get Firefly to work for us. So, but we do have the Zoom recording, so that will certainly be available. And I'm going to look into the AI, the in-house AI for Zoom, because maybe that's a better solution than Fireflies for this. My book, there's a mushroom for that, is kind of the reference text for this, and people are telling me it's a great book. I'm glad to hear that. I worked hard to make it a great book, but wasn't sure that it would turn out that way. And apparently, people say it's very readable and it's very helpful, and they actually enjoy reading it. And you can get it through Amazon. There's a link there. And if you send us your receipt from Amazon to this email, questions@wellpethelp.com, and that's also an email you can use to reach out to me, we will send you a discount coupon of 25% for 2 times for anything on our website for purchasing that book on Amazon. I think you'll really be happy with the book anyway. So that's kind of our housekeeping for tonight. And let us, without any further ado or further do, um, launch this topic. And the topic is anxiety, which is a big topic, not just for pets, but for people. I myself, I woke up this morning feeling very anxious. I'm not quite sure why. I don't think I was anxious about tonight, but you read the news, it makes you anxious. There's so many things going on in the world today that make us anxious. And we know that our pets that live in close relationship with us pick up on those things. And so, I wouldn't be surprised to know that we're seeing more anxiety in pet parents and consequently more anxiety in their pets as well. So it's a big topic, and I'd like to say, that I've got magic bullets. I mean, I've got a silver bullet. I've got some of those supplements that help to reduce nervousness and help to reduce anxiety, but they're not cures. Anxiety is really a situational thing. It's really lifestyle. It's really everything. And so the supplements are helpful, and especially for animals or people who have a very low level of anxiety, some of these supplements could be all you need, and hopefully that's the situation, because when you have severe anxiety, it's tough, and many times these supplements may not even touch it, or they may slow them down a little bit, and I kind of jokingly say, and I don't mean this to sound bad, but sometimes when you have someone who's anxious and whose mind is just everywhere, you have to do something to slow them down, something to slow down your pet's mind that's everywhere, so that you can create some safe boundaries for yourself or for your pet. So, so we'll talk about the supplements quite a bit because that's, my main deal. But we'll talk about lifestyle changes as well. And actually, before I was going to get to this slide, sorry, I wanted to start, as I was mentioning my book, I wanted to start by reading the first two pages of my book, which is on the topic of cat anxiety, because I tell stories in the book, stories of patients I've worked with, and I think it's helpful. You may see some similarities in your own household or in your own pets. And some of these suggestions I make may be helpful to you as well. So, cat anxiety, cat fights. Two male cats literally pissed off with each other. Jessica, not her real name, brought her new, young, purebred, ragdoll male cat into my office for fighting with her other male cat and urinating in her house. For those who have cats, does that sound familiar? She was a cat lover and had five in her household when she added little Johnny to the mix. She bred these cats to make a little extra cash to help pay for their food and medical care. She did not have Johnny neutered, for she wanted him to breed her youngest female, Sasha. If their offspring was, as she had hoped, she was going to keep him to replace her existing aging male stud cat, Sebastian. Unfortunately, as I could have predicted, the introduction of Johnny didn't go over so well with Sebastian. He hissed and he spit at poor little Johnny, and as a result, he cowered and hid whenever Sebastian came into the room. They would fight occasionally by the food bowls or when Johnny wasn't submissive enough to Sebastian. Johnny grew older, larger, and stronger as he matured into an adult cat. One time their fighting was so bad that Johnny, who lost, developed a cat fight abscess that needed to be treated at my office. I lanced it and put Johnny on antibiotics for a short period of time to get over the bacterial infection that resulted from the puncture wounds of Sebastian's sharp claws. And those claws, I mean, they're scratching in the box and everywhere else, and they penetrate really deeply. So you get these deep puncture wounds that inoculate it with a pretty pathogenic bacteria that then festers and causes those abscesses. At that time, Jessica and I discussed her social problem with these two males, and I suggested trying some CBD for both of them in the hopes that its calming nature would allow them to get along better. I sent her home with a CBD CBG product, which has superior calming properties to CBD alone due to the additional CBG it contains. I also sent her home with some powdered lion's mane mushroom extract to blend in with their wet food for its calming properties. I advised her to give each cat 2 to 4 drops of this formula in their food twice daily, along with a quarter teaspoon daily mixed in the food of the lion's mane mushroom extract, and to call me in a couple weeks with her progress. Jessica called a couple weeks later to say the CBD, CBG tincture had settled them down some, but the household wasn't perfectly calm all the time. I explained that the testosterone both cats had, as a result of them not being neutered, was driving this behavior problem, and if she had them neutered, which she was not considering since they were breeding males, the problem had a 70% chance statistically in terms of the history that we've compiled over the years with this problem of being solved based on the statistics of tracking male behavior before and after neutering. I offered a few integrative approaches that didn't involve neutering her males to help with her problems. Cats are very territorial, and part of the issues happening between Sebastian and Johnny were turf wars. Cats express their ownership of a territory by marking it with their scent. They have scent glands on the bottoms of their paws, around their chin and jowls, and on top of their head in front of their ears. If you thought that your cat was rubbing up against you just because it loves you, think again. It was actually that's the way that they mark you and own you. Your cat, I'm sure, loves you, but he or she also owns you by rubbing up against you or scratching your furniture or carpet. When they scratch, it's not to sharpen their claws, as many believe, but to mark it with the scent glands on their pads or their paws. This tells other cats they own you, much like they own territory in your house. There's probably no stronger scent than that of cat urine. So urinating in the house is also a means of owning it by marking it with their scent. You can use this scent marking to your advantage with the use of commercially available feline pheromones to mark your household with that generic feline scent. All cats own this scent, So if you mark your household with the pheromone, it will help to reduce this inter-cat conflict. It helps, but it's not always 100% effective. So using the pheromones in combination with a CBD type of formulation will work even better than using either technique alone. Now, Jessica's problem is not easily solved since she needs to keep these cats intact for her breeding program. However, for most cat owners, neutering your male just before the time it reaches sexual maturity and begins the bad behavior of urine marking or intercat aggression will solve this problem very well. Another solution I didn't put in this chapter specifically, also if you have a large enough living space, is to allocate separate spaces for the two male cats. Let the female cats go between the two spaces, but not the male cats. This way they don't get to interact and have that kind of anxiety producing behavior. Okay, so the dictionary definition of anxiety is excessive and exaggerated reaction to a perceived threat, leading to feelings of fear and nervousness that are expressed as non-normal behaviors. In dogs, it's primarily expressed as a fearfulness. Loud noises, thunder, fireworks, those are commonly ones. Unfamiliar people in your household, strangers, scary actions or events. Being left alone or travel can be very scary, especially if they're not used to it and they start doing it as an adult animal. Starting with a younger animal is more likely to get them used to some of these activities that might otherwise frighten them. Dogs express this fearfulness, this anxiety with hiding, excessive barking, panting, trembling, whining, irritability, and occasionally aggressive behavior. Sometimes aggressive behavior is actually fearfulness. And in the veterinary world, we call them fear biters. And that's something that is not that uncommon to see in a veterinary clinic. And veterinarians, as a means of self-protection, I think, learn to read their patients very well as far as their level of anxiety and fearfulness, and also whether there might be a little bit of aggressiveness there because we don't want to get hurt. We don't want to get bitten. In my 30, 35, 40 years of practice, I was bitten badly only twice, which I'm proud of. I bet it was only twice because there were a lot of other opportunities and I was pretty fast. So let's see, where were we? Also destructive behavior, and we've seen this with dogs with separation anxiety. Some of them will actually, scratch their way through drywall or doors. They'll leap through plate glass windows. They can hurt themselves a lot. They can do a lot of destructive behavior in the house. And with dogs, as with cats, we also can get, as a result of their fearfulness, urinary or fecal, I call them gifts. Often usually anxiety is an acquired trait, not genetic, although there can be breed tendencies. We have some dogs that are, naturally pretty high strung. Some of the hunting dogs, for instance, they're bred to be high strung because the hunters want them to be out there and, just on the top of their game. But this kind of fired up, energy level can also make it more easy for them to become anxious given the right stimuli. Um, and let's see, and also events that occur when they're young, as a puppy or kitten, can affect its entire life. And that's one reason, especially as we see an increase the number of rescue dogs that are being adopted. And thank you all for doing that. It's what I do. And it's a gift that keeps giving, but it also, is quite a task to help them. And and so, like with Ollie, for instance, I know that he was terribly abused when he was just 3 or 4 months old, so much so that it broke his leg and dislocated his hip. And when I adopted him after those things had been repaired, lifelong, I've had him for 11 years now, and he's still very anxious. As a lab, he just wants to be close to me, but when he gets close to me, he can't stand to be close to me for very long. So, so so that's when we oftentimes see the acquired anxiety occur when they're very young, and that really imprints itself on them. And it's a hard thing to get rid of. Oftentimes we have to just manage it, maybe manage the environment, manage our behavior towards them, and use supplements and things to help kind of downsize their anxiety as much as we can. With cats, it's a different kind of a picture. It's more territoriality. Their cats are very much into their territory, their turf wars. And if it is territoriality, then I think pheromone therapy can be a really important part of that. Because if you make the whole house smell like self to every cat in the house, then they're not going to feel like they're competing with another cat's territory. Um, but new and unfamiliar cats or other animals in the household, moving to a new home, loud noises like, let's say, construction next door, and not uncommonly, the neighbor's cat that lets the cat out and goes and pees next to the window, or just stands in the window and loves to see your cat going. "Meow." So, I mean, there's all sorts of things, and some things you have control over, and some things you don't. So, so that's kind of why I think anxiety is such a big deal. And so many people, you know, are so many people's animals and themselves are troubled by that. It's definitely something that's real and difficult to deal with. So I got a couple of I harvested a couple of images from the internet, and the internet has a huge amount of information on this, a lot of cool pictures, with cat behavior. We know that their body language is really very strong as far as how they hold their ears, how they hold their tail, whether they're hunched in the back, and you can see several different images here: cat anxiety symptoms, aggressiveness, following you around, hiding, insistent meowing, over grooming, loss of appetite, lethargy, vomiting, and diarrhea. Um, can also be an issue. Just the nervousness, they just can't hold anything down. Trembling, litter box accidents, that sort of thing. Dogs panting, drooling, compulsive or destructive behavior, accidents in the house. So there's a lot of good information out there as well, on these different topics and symptoms. And I've got, let's see, other things here. Okay, so the next slide is what to do. So there can be medical reasons for causing anxiety, and as a doctor, of course, that's always in the top of my mind. And you may not know that dogs that later on become epileptic, oftentimes before they become epileptic, we can see behavior changes in them. And those may actually be early warnings, that epilepsy may be impending. We can also have disease problems, metabolic changes like Cushing's disease, which causes the adrenal glands to produce an excessive amount of steroids, and steroids can affect behavior. But the adrenal glands also are the source of adrenaline, which can create that fight or flight, fearful behavior. So there can be medical causes that underlie the behavior you're seeing. Cancer, brain inflammation, or a brain tumor could be an issue, or even not cancer, but there can be granulomatous problems in the brain. Adrenal tumors causing more steroids or adrenaline could also be a cause for it. So what you need to do is you want to see if you can figure out what are the triggers. What is it that you're doing or is happening in the environment that is setting these guys off? And if you have any ability to control those triggers, if we can stop those triggers, if we can extinguish them, then we may be one step further in terms of managing and controlling the anxiety. One thing, for instance, is separation anxiety is a big thing, especially, with all of those COVID puppies, pandemic puppies that we're used to having you at home all the time. And then, pandemic's over, got to go to work, got to leave them alone in the house. And boy, they can't stand that. So, there's things that you do when you get ready to leave the house. For instance, you pick up your keys, or you get your coat, or whatever it is you do. And our pets are really smart. They see all of these patterns of behavior that we do, and they know that one pattern of behavior is associated with you leaving. So when you start using that pattern of behavior, they start getting wound up and anxious even before you leave. And one thing we know about anxiety, just as we know about fear, is that once anxiety gets started, it kind of winds up and kind of feeds itself and gets worse and worse and worse the more it winds up. And if you try to intervene with a drug or a supplement or a behavior or even acupuncture or some of the other tools I'll show you, once they're wound up like that, boy, it is like really hard to get them to change. And so that's why I'll be suggesting when we talk about how to use the supplements for anxiety, I suggest that if you have an anxious animal, that we use kind of a baseline level of these supplements all the time to kind of lower their anxiety level. And then if we can intervene early before the anxiety gets wound up, could double or triple the dosages of those and help to keep that anxiety level down as well. So, and then, the cues are important, but also desensitizing, your animal. For instance, some people say that using that getting a recording of thunder, and playing at a really low level in the house can get your dog used to that. And that may be true. I think with the thunder comes a lot of pressure changes that the dogs um, also cue into to get nervous about the sounds. But there are things that you can do, and it may be very situational, very specific for your situation, your life, your household, your animal. And it may be that you need to find a behavioral specialist. And these days, with online consulting, you can find specialists all around the country, all around the world that are willing to work with you and can do it, through that virtual connection, in many ways and help you with that. And I encourage you because I don't think that there's necessarily a drug for this, or a supplement for this, or a mushroom for this. But they certainly can be very helpful with all the other kind of lifestyle changes we need to make. So, and always reward good behavior. Don't punish bad behavior. Dogs don't learn anything by being punished. They learn by being rewarded. And that's what I suggest, because punishing the bad behavior may actually make the anxiety worse. So, we want to talk now about interventions, medications, supplements, diet, acupuncture, herbs, and the loop. Um, and let's go here, and then I'm about done with this, and then we can open up to questions. So I talked about the pheromones. There's one product out there called Feel Away, which has worked really well for me, but I know there are other like products available as well. Cannabinoids like CBD, which is known to be calming. It stimulates the serotonin receptor. CBG also stimulates the serotonin receptor, plus several others that CBD doesn't. That's why I have CBD and CBG combined in my Doc Silver Naturals cannabis products. CBN is actually a form of THC that's degraded and not as psychotropic, might be mildly psychotropic, but can contribute to sleep and can be helpful with anxiety, not as much as CBD and CBG. THC is oftentimes associated with panic attacks. So, with anxiety, I recommend not using a THC-based CBD product, which normally is called full spectrum. But if it is full spectrum, you want to see that it has very, very low THC in it. Mushrooms like lion's mane, reishi, tremella, golden oyster all help to work on the nervous system and settle it down. Um, I've developed a formula here called Mushroom Relax Chews that have reishi and lion's mane and tryptophan and theanine and calming herbs in them. They work quite well and work even better when you combine them with CBD. Tryptophan itself, you can get that as an individual amino acid and just give that in capsules or open the capsule, mix it into food. It can also be very calming. It creates serotonin, which is kind of the vegetative neurotransmitter. Theanine is what gives green tea its zen. And then there's a number of calming herbs: valerian, catnip, lemon balm, passion flower, ziziphus. And then there's a protein found in milk called alpha casazepine. There's some products out there that have that in it as well. And guess what? The microbiome can actually enforce calming as well. And Purina, which is a big pet food company, and I'm not as keen on their pet food, but they've done an awful lot of incredible research into the microbiome. and I really love the information they're presenting. And they've developed a probiotic that they have objective data that shows it can be calming. And with microbiome these days, when they do microbiome transfers, if they do the transfer of the feces from a dog who is a very calm, chill individual, and you can transfer the feces into an anxious dog, it makes that anxious dog more calm. I mean, that's really amazing how the microbiome, it's that gut brain connection, you know. Um, and then this is kind of Star Trekky, kind of woo-woo here, but it works, targeted pulsed electromagnetic force devices. And this is a company called Zomedica, and this is called the Assisi loop. They call it the Calmer Canine. This loop generates this electromagnetic force which goes into the brain, and it has a certain kind of frequency that's calming. Crazy, right? Really Star Trek. Anyway, so that's kind of my input. Why don't we open things up for some questions? Um, and let me get rid of this thing, if I can get rid of it anyway. Okay. And then let's have some questions. And Haley, we got some questions sent in. Why don't we start with those and go from there?
Sure, sounds good. So question here. I have a 3-year male old lab mix, Max, who is easily triggered. Certain noises like car doors closing, people walking outside, and delivery people trigger him with barking that takes a while to stop. It began when he was around 5 months old. Max has had extensive training, which has improved the behavior, but he's still triggered, and once he calms down, he does a lot of stress yawning. He barks at anything outside the house or car, yet when he's in store on a leash, people or noises don't bother him at all. I've used your silver bullet, which minimizes the behavior, but he is still triggered. Some of this might just be his personality, but Max is clearly territorial, and any suggestions that can help are appreciated.
Well, it's kind of interesting because it sounds like his behavior when you're attached by a leash is actually calmer. And commonly I've seen that when the dog is on a leash, it oftentimes they feel kind of territorial about the owner. That's when, if you're out walking, the dog can be very defensive, with other dogs or with other people. So I'm glad that you found some effectiveness, the from the
Silver bullet.
silver bullet, right? Sorry. Um, and I don't know if using, anything more is really going to solve the problem here. And this is a situation in which I think you probably need to have more of a detailed interview with someone who can go over the details and ask you the questions about, which we don't really have the context to do that in right now, ask you the questions regarding what may be some of the cues for this off leash behavior and what can we do. And maybe, in some cases we can't do anything, but being aware of what the triggers are can allow us to avoid them or to take measures as far as maybe putting a leash on him when we know we're going to be in a situation where he's liable to be more reactive. Is that person who asked that question here tonight? Okay. Well, if you did, you could certainly comment on something if you wanted to. But let's go to the next question. I know we've got lots to ask. Raise your hand if you are here.
All right, next question here. My
Mhm.
7-year-old male rescue never used to mind riding in the car, but all of a sudden, a few months ago, he pants a lot the entire time he is in the car. Also, he starts panting whenever I do laundry from the sound of the washer or the dryer. These are all new things that I've developed that have developed over the last few months. Anything you can do to help?
Well, the first thing I would do, and what I commonly do when I'm presented with information like this, is I ask you to kind of go back in your calendar, whatever, and to if you can sort of pinpoint approximately when the behavior changed, see if you can correlate that the time when the behavior changed with something that may have been going on in your household that maybe at the time you weren't really aware that it could have been something that affected the dog. Maybe your work schedule changed. Maybe, your kids started school. I don't know, maybe your washing machine needs to be fixed. I'm not meaning to be facetious about it, but it's sometimes it's things that we don't even realize could have been a trigger that were. And I think that's really the first place. Certainly, I would encourage you to try some of these calming supplements. We have a good choice of them. I've got some available on the website and giving you a discount, so that's not a bad place to start. And they may be helpful in terms of settling the dog down, but we got to find out, because the dog was not this way to begin with. So something happened that intervened and made the dog get to be this way. Let's see if we can figure that out, because if we can, then maybe we've got a way to fix this. And you can see most of my advice tonight, I think the supplements are great, but most of it's going to be around, trying to figure out what we're doing, how this happened and what's triggering it and how can we eliminate those triggers? And I think we're going to be in a much better place. Next question, please.
All right. My kitty is very anxious. He's been like that since he was a kitten. 1 year ago, he had a urinary blockage, which caused us to rush to the ER. I didn't know any better at the time that kibble can cause blockage in some cats. I was dealing with my own health issue prior to that, so life was just extremely busy and stressful for myself. I am
Sorry.
more calmed down now and hoping that it will help my kitty be more calm. We are moving to a new house 40 minutes from where we live, so it's a bit of a drive, plus the new environment. My question is, what can I do for him to make this transition less stressful?
Well, I think, in this case, this kitty has been anxious for such a long period of time. Um, Probably from some early rearing issues, maybe things that you weren't even aware of that happened, while it was still in its litter, before weaning. I mean, things can happen that early. Um, and so I think in this case, looking at something that can help to help to lower that level of anxiety, especially since you've got a move coming, would be a good idea because it's not just the moving into the new house, it's going to be the moving out of the old house as well, that you're going to start moving things around the furniture. They say that joke about with Helen Keller and moving the furniture around, but with cats as well, you move the furniture around, they hate it. It's like they're used to where everything is. So I think starting early, as I was mentioning, before you do anything more, and you're feeling better too, so that's good because they feed off of us, and that'll be helpful for you to do that. And I don't know if there's any kind of behavior or holding or nurturing or petting that can be helpful. I don't know if you tried catnip. For cats, catnip is a particularly good calming agent, worth trying. Gets them a little excited first, kind of like alcohol, but then they slow down, they get tired. And I used to use catnip all the time in my exam room. I would have the pet parent come in with the kitty cat, and we'd usually just let the cat be on the floor. I don't think cats like to be up on tables anyway. I think it makes them nervous. And I'd have the my nurse just toss some catnip, some organic catnip leaf on the floor, and we just leave the cat to his devices, and he'd eat a little bit, maybe roll in it, maybe get a little excited, and then calm down. Made them much more tractable that way. So you might want to look at that. You might want to look at some kind of touch therapy, just more nurturing time, maybe time just the two of you. Maybe there's a safe spot in the house that you have with this cat that you can do that with. And maybe that's a safe spot that while you're moving things around in the household, you can have the cat can stay with everything the same in that same safe spot. And maybe that is where you would keep the cat confined to that spot with its box, with maybe, and if it's used to being in a carrier, with some cats they find its safety in a carrier because it's kind of small and they feel safer in there. So, creating a safe spot in the household can also be a good way to do that. But I would look at, the tincture. I think it's most easy to give to cats. The sterling silver is the less potent one, so it's more adapted to cat size, and you can start with just a single drop in the food. It's pretty bland, and then you can kind of increase that and escalate that. And you can reach out to me, and I'll help you figure out the dosing because I need to know weight of the cat. And maybe you have another CBD product, and that's fine. If you want my advice on how to dose that one, I'm happy to do that too. I just need to know more about it. So, but this is, this is kind of how you think about these behavior problems and anxiety. It's not an easy thing, and that's why some vets just specialize in behavior and just do that. And those can be good vets to know, if you've got a really difficult problem. So, that's good. Next question.
Right. I have three 18-year-old sibling cats. Two are in what appears to be overall good senior health, but the other one has a few issues. He suffers from hyperthyroidism, sorry, and allergies. He currently takes, let's see here,
Methimazole.
methimazole for his allergies, and he
No,
takes,
that's for the hyperthyroidism.
oh, I'm so sorry.
Mhm.
Yes, for the hyperthyroid, and then for his allergies, he takes, I'm so sorry if I botched this, but chlorpheni.
Chlorpheniramine. Yeah,
Yes.
that's an antihistamine. It's a little bit sedative. Hmm.
This stresses me because of the uneasiness of giving these medications long term and to a reluctant participant. On the other hand, let's see, my senior cat stays so stressed also because of these awful tasting meds have to be divided into tiny doses just to get the daily dose to him.
Okay.
So this is the senior friend, sorry. This means dosing several times during the day, and no matter how I disguise it, he is not cooperative. When he sees me, I see it on his face. Oh, here she comes again. In
Hmm.
between the dosings, I make it a priority to pet and talk to him so that he knows that my every encounter doesn't mean yucky meds time, but alas, he still doesn't trust me. Any advice on this stressful situation and possible holistic alternative support for his two medical problems would be greatly appreciated.
Well, if you've got three 18-year-old cats, you're doing something right, first of all, you know. But this is complicated, and I think there probably are better antihistamines to use, or better treatments for the allergies that you're describing. The chlorpheniramine, just the administration of it, creates some anxiety, and it creates some sedation. There are some other allergy medicines like Zyrtec and sertrazine, which are not as sleep causing and may be easier to get in there. I don't think they're quite as bitter. But there is something that is pretty tasteless and has been shown to be beneficial for allergies in cats, and it's a powder called PEA, or palmitoyl ethanolamine. We carry that on my website in capsule form, but you can open those capsules and they're tasteless, and it should blend quite well in with the pet food, wet food. And it can take a month to build up, but the research is really pretty good with it. And I think it works more on the immune system than on suppressing, that histamine-like reaction that causes that sort of that upper respiratory symptoms. There are some herbs that could be used, but again, the administration of the herbs could be, rather anxiety forming. Um, maybe looking at adding some mushrooms to help improve immune system response regarding the allergies would be a good idea. Something like lion's mane is very palatable. There are some mushrooms which have antihistamine-like effect. I'm not so sure a cat would be accepting of the taste. Some cats might. It's called Five Defenders, and it has reishi mushroom, which is a powerful mushroom, but pretty bitter, and it has chaga mushroom in it and three others. And the chaga and the reishi both are able to have antihistaminic benefits as well as help the immune system to work better, to kind of reduce the allergy, because the allergies are when the immune system's not working so well. And so that would be something to consider. And then, around the anxiety, I would say, I would also suggest trying the CBD, CBG tincture, in the food. It's complicated what you're asking, and it's not just a simple answer that I can answer in this context. And it may need, a holistic veterinarian, to really dig deeply for you to work with you to find the right supplements that the cat will accept that will help with the allergy and the anxiety both.
All right, next question here. I have three dogs, two seniors, 12 and 13, and one 6.5, all very active mini Aussies. They are all healthy, no major issues, thank goodness. I give them sterling silver twice daily at the recommended dose and have been doing this for 8 weeks. My question is, should I continue this for general wellness or should I take breaks or reduce the daily amount?
Well, I mean, I believe strongly in the long-term value of using mushrooms. And I think even small amounts of mushrooms given every day, are so much better than larger amounts given for a short period of time. So I definitely encourage you to continue with it. Um, if the amount that you're giving is a bit difficult for the cat to accept, or if the amount, dogs, I'm sorry, is a bit difficult to accept. We could reduce it a little bit. And we do have, a number of different options available, with mushrooms that might be more tasty or more cost effective for you. Any mushroom is really fine. Believe me, all the mushrooms have very similar properties, but, we can see certain specific things. And so if there's one mushroom that is more palatable and easier to give long term and give the kinds of effective dosages that you want to give, then, I would look to use that one instead.
All right, next question here. How do I stop or reduce the mini meltdown my 80-pound chocolate lab has when he sees a small dog, either in a car that pulls up near our car or when in public on a leash? He doesn't have many dog friends because of his whining, frothing in the mouth, and acting kind of wild. He is a really loving guy, but due to his size and his anxiety, it's very tough to bring him around other dogs. He is now 10 years old and has mellowed somewhat, but it's still an issue. Any ideas?
Well, what you're describing is potentially a really dangerous problem in terms of your large dog seriously injuring, a smaller dog that it meets, out there. And I think that, it's important for you to continue with the control measures that you've taken. And I don't know, that we could make a difference in a dog that has had this for 10 years, and it seems to be kind of hardwired into it. I think that's going to take more of what we talked about. We know what the cues are. The cues are the other dog, and maybe is it more like that with smaller dogs, or we don't really know. But so the cue would be the other dogs, and so we would want to try to desensitize him. And so we might want to use some supplements or some drugs to kind of downsize his anxiety and his energy and expose him in a safe environment so that he can, be exposed to a small dog without having that excitement. I think you need to have, professional help in terms of a behaviorist to help you with that, because I think there are potentially dangerous events that could happen if it doesn't work right and somehow your big dog gets into the little dog. And we have a condition we call it in veterinary medicine, we call it big dog, little dog. And it's when a big dog picks up a little dog and shakes it. And usually they shake it and they break its neck. It's not a good thing. So yeah, I know. So so it may be there is no fix for this. I wish I could offer fixes for everything, and sometimes there aren't fixes, but that you've identified it's important and that you've been able to exert measures of control to prevent any problems from occurring is good. I don't know if you've tried any of these supplements. That'd probably be the easy place to begin to see if we can reduce his anxiety and or maybe if the supplements you've been using haven't been that effective, try something different. And at least in that environment where we've got the anxiety reduced, maybe we can get a little more control once we, can desensitize or reduce its behavior from the cues of the small dogs that it meets. These are difficult problems. Thank you for asking them. I like the challenges. They're not always easy to answer.
All right, next question here. I'm a retired feroler, and one of my cats, rescued from my colony as a kitten but now about 10 years old, has been living in my bathroom cabinet since last August. I've set up the cabinet with a pillow, a litter box, and food and water bowls, but she's getting chunky from lack of exercise and, of course, gets no sunlight or quality of life. Forcing her to leave by removing her food and water will not work. I realized she was dehydrated, though there are water bowls just 3 feet away from the cabinet. Her fear seemed stronger than her need for food and water. I believe this began when my next door neighbor had a SWAT team filling our cul-de-sac for about 3 hours on August 2nd. He refused to come out. I believe the negative energies affected her profoundly, though my other 4 rescue cats and my senior rescue pitty seem fine. I've tried rescue remedy, Mimulus pheromone spray, gabapentin, and brought a book by Joan Ranquet, Emotional Freedom Technique for Animals. But she resists the tapping and struggles to get away and flees to her cabinet. She eats and drinks well, uses her litter box, and had a health checkup a few months before this incident.
Okay, well, these are really tough problems. Obviously, rescue cat, who knows what happened before to create these kinds of fears. I don't know if you have tried any supplements. I mean, that'd be a good first place to begin. You've obviously tried, to modify things, modify the environment, and there's just, doesn't seem like it's been very successful. So I would, say let's see if we can, calm them down a little bit, with some. And again, I think the CBD, CBG tincture is pretty easy to use. You can do it drop by drop, in the wet food. You start with just a single drop and kind of work your way up. Twice daily, to see if you can settle this kitty cat down. And it may actually need, something stronger, as well, in terms of maybe a pharmaceutical for the times when the cat is particularly reclusive, when things are frightening it quite a bit. But as everyone can see, these are typical kinds of behavior problems that are very difficult to solve, that have been going on for a long period of time. And it's certainly not, I'm not saying let's give up on them, but it's not, there's not an easy answer to them. And so the combination of trying to identify what are the cues, what is the underlying, what's the underlying personality, what are the cues, and what can be the fixes, and then applying some medication, some supplements that can help reduce that level of anxiety, so they may be more um, adaptable to the changes that we make, is really the way that we want to proceed. And some animals will respond. I don't want to give up on any. I never give up on any. Some will respond, and some will not respond as well as we'd like them to. Next question. And or do we have questions coming in from the audience as well that maybe we should
Yeah.
answer them?
Yeah, we can do one of those. So here's a question here. My dog Ruger has anxiety, which and he is taking CBD and the Relax Chews, which helps some. He also has allergies. Can I give your immune mushrooms with the Relax mushrooms?
You can, and but I think that the immune chews, if that's what you're referring to, because the soft chews for the relax are good, but it's possible, that something in the soft chew matrix um, may be part of your dog's allergies. And so I think, depending on a more in-depth conversation regarding the allergies, it may be that we want to do a food allergy test to see if there are any offending ingredients in those soft chews that could be driving the allergies. I mean, these are two very complicated problems. But yes, there's going to be no interference with giving the mushrooms that are in the relaxed chews and all the other ingredients with the immune chews. The immune chews contain the five defenders, which you can get as a pure mushroom extract, so you don't have to be giving that matrix. We don't really have the relaxed chews in a combination powder that allows you to eliminate the matrix. So we would have to give these more individually, and that's something that I can instruct you how to do, um, in terms of trying to see if we can eliminate the soft chew entirely, but continue with the mushrooms and the herbs, and eliminate the allergies. Because it could be the matrix itself is part of the problem. So,
Right.
mhm.
So, next one here. My dog was diagnosed with idiopathic epilepsy 2 years ago and is currently on four anti-seizure meds, mushrooms, lion's mane, and silver bullet CBD. In the past 6 to 8 months, he has begun to have separation anxiety, excessive barking, and nervousness, especially in the evenings, but also sometimes during the day when I'm at work. The wonderful news is that after adding FMT capsules, he's not had a seizure since December 27th, 2024, when he typically had cluster seizures once a month. But his separation anxiety is getting worse. Suggestions on easing his anxiety? He is 4 years old.
So this is probably a case where there is a relationship between the epilepsy and the behavior issue. And FMT, for those who don't know, is a fecal microbiome transfer. So the microbiome transfer may have been from a dog who didn't, probably was from a dog that didn't have epilepsy, could have been from a dog that did have anxiety, and you can pick up the behavior, um, from the other animal through their microbiome. Um, and so I think in terms of resolving the or easing the anxiety, I think the relaxed chews, are particularly good in combination, with CBD. Um, but you may also want to look at adding more medium chain triglycerides as an oil to the diet, and probably some fish oil as well if you're not already using those. Um, it's known that a ketogenic diet can help with these kinds of behavior issues that we see. Um, Maybe not a fix, but can help with them. And that a ketogenic diet can also help control epilepsy. Now, the epilepsy is under control, but we've still got the separation anxiety. So that was, we said, separation anxiety. So, so again, looking at the cues that you're doing in terms of picking up the keys or whatever it is to signal this dog that you're leaving and he's anxious about that. If we can extinguish those and figure a way to do some countermeasures to have the dog be more secure, would be, a good idea. But I think the oils, I would look at the fish oil, and I would with EPA and DHA and give a pretty substantial dosage there. And I would look at the medium chain triglycerides, as a place to begin with that. I don't have a and I think that's really great. I mean, what a great story that you did. You gave some capsules of another dog's freeze-dried feces, and it helped the epilepsy substantially. I think that's really an important fact right there. So we're nearly there. Now, Marianne has raised her hand. Why don't we ask her to unmute and ask your question, Marianne?
Well, I really don't have a question, but thank you
Oh,
very much. Love you, Doc Rob.
no, thank you.
But the question you just answered was for my dog, my Welsh Springer Spaniel.
Oh, okay.
So he is on MCT, um, and he's
Okay.
on gently cooked food diet. So pretty much a
Okay.
keto diet. He doesn't really get any carbohydrates in that. So,
Oh, good. Good.
but the FMT has been a game changer as far as his seizures, adding that.
May I ask you which brand that was?
The FMT, it's
Yeah.
the doggy biome
Doggy Biome, because that
or
there's
animal
also
biome. Yeah.
okay, Animal Biome. Yeah, they're a very reputable company. They really were the first, with this kind of product, and they do extensive microbiome testing. So that's good. That's excellent information.
And he's talking to us now, so I
Okay.
don't know that you can hear him, but he's talking away.
Okay. Yeah, so I think you're on the road to success. I would look at maybe adding, the relaxed mushrooms for that. And we don't know, I don't know what size the dog is or how much MCT or how much fish oil you're giving. Those might be places we could modify to give more of them to make sure we're giving enough. Fish
He
oil it
he's
works.
56 pounds, a
Okay.
Welsh Springer Spaniel, but the MCTs I do give, fish oil I don't. Do you have a recommendation on fish oil? Hey, stop.
Well, I do. I mean, I think there's a lot of good fish oils out there. We have one on our website called Ultra EFA that I designed. for another company years ago that works real well.
I'm
Um,
familiar, yes.
and we dose it based on, we add the amount of EPA to the amount of DHA in that formula. So with that particular product, Ultra EFA, each teaspoon contains 900 milligrams of EPA plus DHA. And we want to dose 100 milligrams per kilogram per day. So approximately, your dog is around 60-ish pounds, is about 30-ish kilos. So that's about 3,000 milligrams of the 900 milligrams per teaspoon. So it's basically a tablespoon of the Ultra EFA per day. And you can divide that, per meal, teaspoon and a half, especially if he's sensitive to a lot of oils.
Mhm.
And the medium chain triglycerides, um, I work on a study that was done using medium chain triglycerides. It actually was a study sponsored by Purina again, and like, I'm not that keen on their foods, but the research is great, and in this study, they found that that they could add medium chain triglycerides to a kibble diet, and it turned it into a ketogenic diet. That the dogs actually had ketosis, and they had benefits from their epilepsy. That's kind of the basis behind the Purina
Very
diet
interesting.
called NeuroCare. But there's no need to go there. You can go there with especially with lightly cooked food. I think that's the best food you can feed. Low carbs, I think that's awesome. But adding the medium chain triglycerides at 10% of, you want to have the calories for the MCT need to be about 10% of the total calories in the diet. It's quite a bit. And some dogs will get diarrhea from that. You have to start gradually with it. But that would be a good place to start as well. And we see behavior changes with fish oil as well. The DHA is very strong in the brain, very good for learning and very good for behavior as well. So I think that would be a good place to go.
Great.
Thanks for
Thank you.
sharing.
Thank you
Thank-
so very much.
yeah, that was great. Okay, and it's 7 now, and like I said, we're not going to stop. But if people need to leave, that's fine. But we're going to keep going. Um,
Yeah,
we'll go,
I
we'll
do
go
have another
stop until we
question.
drop. Okay.
I do have another question here that was asked. So we have what can we do to alleviate anxiety in dogs that is worsening due to aging cognitive dysfunction syndrome? My 13-year-old dog is getting increasingly clingy, following
Oh,
me every step, and licks his forearms until they are wet.
right. Yes, this is something we call in dogs canine cognitive disorder. And although we don't have any studies yet in the dog, we have a copious amount of anecdotal information from veterinarians and from pet parents that the use of the mushroom lion's mane really seems to help with cognitive health when it comes to these older guys. So mice and lion's mane as a powder is very palatable. We have it as a powder and as a small capsule. So depending on the size of your animal, if they're better off with a capsule, but the powder is very palatable. Some people say lion's mane tastes a little bit like lobster. I'm not sure I agree with that, but it is tasty. It's one of the more tasty of the edible mushrooms. And it contains these molecules in it. It contains an antioxidant called ergothioneine, which helps with crosses a blood-brain barrier and helps with cognitive function based on objective tests in humans and laboratory animals. And it also contains these terpenes that are found in lion's mane, which have been found also to help with cognitive function, but also to help with neurologic repair and neurologic health. So I would say lion's mane would be the way to go. And that is, and actually thank you for that case, because that was the one thing I didn't mention in my slides, was cognitive health can also cause anxiety, and it causes anxiety in humans. I mean, if you've ever been around someone who has Alzheimer's, they can oftentimes get really angry because they're so frustrated with not remembering or not, so yeah, dementia, which is a hard word to say, but we have it in our animals as well, could be another cause for it. And fortunately, depending on how progressed it is, the early signs of dementia are more easily reversed than the later signs. There's some studies in Alzheimer's patients with lion's mane, early Alzheimer's, that shows shows reducing the progression of the disease with the lion's mane. I'm not saying it cures it, but it's one thing we can use to help modify expression of that disease, especially if you can catch it early. So even before it's diagnosed and the person has, senior memory. I'm older. I've got senior memory, and I've been taking a lot of the ergothioneine and a lot of the lion's mane daily, and my memory has improved markedly. I still have an occasional brain fart. I think I had one earlier tonight here, but it's much better. And I'm anyway, yeah, I want to I want to stay continue to be cognitively healthy for everybody. So that's what my suggestion would be. Good question.
All right, we do have another one here. We are seeing additional improvement in anxiety episode duration length when we added 6 frozen whole raw sardines to their diets 3 times weekly. How is
Uh,
this helping the anxiety reduction?
Fish oil. Marianne, there's an example of an animal that's improved with the use of sardines, which is considered to be a whole food source for fish oil. So bingo, that's what it is. The DHA especially. EPA reduces inflammation. DHA also reduces inflammation, but is very specific to the brain. We've got studies that show that if you give if you give DHA to puppies, or you have puppies that are DHA deficient, that the puppies that have the DHA are much better learning and being trained. And so it really does have an effect on behavior. So yeah, that's the answer to that one. That was great, by the way, to have that.
So here is one more here, just very general, but how about diffusing essential oils when it comes to anxiety?
Well, essential oils are great, but you want to make sure you're using the right kind. Some can kind of stimulate epilepsy. Rosemary, in particular, has been shown to do that. Have to be pretty large amounts, and you kind of have to be, maybe pre-epileptic to begin with. And you don't just have to diffuse the essential oils. You can also put it on your hand, and you can just rub it on the pet's coat, and it also it gets transferred that way. So looking at herbs that would have an anti-epileptic benefit could be a good way, or a calming benefit at least. Herbs like lavender, for instance, which is the classic calming essential oil. Lavender contains a terpene called linalool, and it's the linalool that passes the blood-brain barrier, goes in through the nose or goes in through the bloodstream, and goes right to the serotonin receptors and stimulates them to produce more serotonin, which is why it is so calming. People use it, animals use it. You can even take it internally. Like a drop in some water can be good. So yeah, no, essential oil, everything, any tool that's out there that can help with this is fair game. And herbs, essential oils are just, distilled herbs. It's just muy potente herbs, so using the right herbs is the important thing there. Next question.
Yep, that seems like all the ones that I have here.
What about this one here? 90 days after switching to raw. Did you get that one already?
Uh,
Microbiome support cut the anxiety of my dog by 50% and then added the CBD CBG complex. So, our kids, they eat junk food, and what do? They become hyperactive, and they can get behavior problems. And junk food, we now have a 75-cent term for junk food. We call it ultra processed foods. And that is what kibble is. It's ultra processed foods. It's been extruded at high temperatures and heat, and actually they take the food ingredients that oftentimes are the byproducts of the food processing industry. So they've already been ultra processed, and then they put them into a more ultra processing thing. So with this, we're seeing with SR Collins, that going raw feeding, and it doesn't have to be raw. I mean, I know people are really into raw, and I'm not against raw at all. But it's really get them off the frickin', ultra processed kibble and anything. Kitchen cooking food is wonderful. I think you would get the same result if the food wasn't raw, if it was, lightly kitchen cooked. And we know that there are some foods which are better absorbed and better digested when they're cooked. So I don't think, and we tend to be, and we're seeing this happening in our country, and I don't want to get into that, but we tend to be all or nothing. It's either white or it's black, and there's no gray tones anymore. And, I would say, feeding some raw is good and feeding some cooked is good. And, for instance, broccoli, we know that broccoli is actually more potent when it's steamed versus when it's raw. You can use more of it. So I think, being aware of what foods benefit from some light cooking or steaming and what foods benefit from being raw could create a more ideal diet than just going raw, gotta be raw, gotta be raw, you know. But that's good information, and so that's the diet connection as well when it comes to anxiety and something that, we should all look at. Those folks that had the anxious animals with the difficult to answer questions, we should also look at what you're feeding and try to get something in there that's not ultra processed and try to get some fish oil in there or sardines. Um, I had a consultation with a nutritionist last night for myself, and she's really smart. And I asked her because I've always wondered, how can sardines be good sources of fish oils if fish oils, fatty acids, the EPA and the DHA are these really long chain fatty acids, they're very delicate to heat, to being destroyed by heat. And in order to can sardines, you have to, heat them up pretty high to kill all the bugs so you don't get botulism and stuff like that. Um, and I asked her, I said, so um, why are sardines any good if they're being processed with so much heat? And why are people being told to eat cooked fish when, you're cooking the fish at high temperatures? Doesn't it alter? She couldn't answer me, and so I guess for now, I'll say, yeah, keep feeding those sardines until I get a better answer and understand if it really is better just to give the fresh, raw fish oil or krill meal, that sort of stuff. And for my own dog, what I do, he gets a lot of fatty acids. He gets, like Marianne, he gets a tablespoon, of the Ultra EFA a day, and he gets 3 tablespoons of flaxseed meal. And the flaxseed meal is rich in omega-3 alpha linoleic acid, which is not as anti-inflammatory as the fish oil fatty acids, but nonetheless has a lot of benefit in the body and is also high in omega 6s, which the body needs to have good, fresh omega 6s, but it's also high in plant lignans, which are these cellulose type molecules that actually bind up toxins. And it's also got great soluble fiber as a prebiotic for the microbiome and insoluble fiber, which works kind of like a brush to cleanse the large bowel. So even if you do nothing else, adding these healthy oils can be very, very beneficial for your critters. And I strongly suggest you check it out. Um,
There is one other question here, which I think we could make a little bit broader,
okay.
and it can be helpful. So, on days of fireworks, can we dose more on those nights, whether it's the relaxed chews, whether it's the CBD?
Right. And this is and of course that was part of our reason for wanting to choose anxiety as our topic. And if you are on our email list, we also chose anxiety or fireworks rather, because we're starting to get ready for 4th of July, which is a dreaded holiday for many dogs. And because of the delay it takes in the mail, we thought it would be good if we started early with recommending people get stocked up early so they have that on hand. And just as I had suggested, that a dog that has anxiety should be on some kind of maintenance level of these supplements that are calming, that's what I recommend prior to the fireworks as well. If you have a dog that is reactive to loud sounds, put them on kind of a maintenance level, and I can help you with those dosages once I know, weights. You need weights for dosages. Um, and then around the time that you're going to have the fireworks, and it's impossible to predict, but generally, the kids in this neighborhood start setting them off, a couple of days before 4th of July, so you might want to double or triple that amount for that 5-day period, around the 4th of July just to get them more settled, you know. Some people like to use these desensitizing effects like playing music low, like I mentioned about thunder. You could also, you could also have fireworks. I think, what is it, the 1812 overture? That classical music, I think that has fireworks going off in it, or at least the timpani drum, playing them at a low level, may help to desensitize the pet. But yeah, no, that's a great question. Thanks for bringing that up, Haley. We had decided beforehand we were going to talk about that and didn't get there, but we did. Good. Thanks. So I guess we're nearing the end, aren't we, here? 25 new messages? I didn't even see all those. So let's see. And let's see. So what are some of these questions here? Um, where do you get let's see. We Collins again, we are seeing additional improvement in anxiety episode duration, and then we added the sardines, so that was them. And then la 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 la. Okay, that's a nice company, Raw Dog Food. There's a number of great companies out there, and I'm really impressed by that. When I started vet medicine back 30 or 40 years ago in 1982, and I tried to recommend healthy diets, there were nothing available commercially. So I had to teach my clients, each one individually, how to prepare homemade diets for their pets. And we individualized the diets for each one. Took a lot of time. It was good, and but now, we've got so many people doing it for us, it makes it so much easier. Costs a little more than doing it yourself, but it does save you time. What brand of lion's mane do I take, Dr. Rob? I take Real Mushrooms products. And full disclosure, I'm chief veterinary officer for Real Mushrooms. I joined them because they are, in my opinion, globally the top manufacturer of mushroom extracts in the world. They've been doing this for 50 years, although their parent company's been doing it for 50 years. Real Mushrooms has only been doing it for 10 years. But their products are extremely pure, extremely potent, third party tested, organic, and yeah, I take a lot of them. And so those are really good. We sell them, on the Well Pet Dispensary, but you can also go to the Real Mushrooms website and buy directly from them. Um, and yeah, Karen, you can take it along with your cats. One for me, one for my cats. Now, with cats, as with cats, you need to start slowly. You need to start gradually with a very small amount. Some cats, they're so particular, they'll never get something new in them. But many of them, especially if there's some really tasty wet food that they might kill for, just start with a pinch. I mean, really, a pinch. Because cats, if you, and I'm fond of saying this, maybe you've heard me say it before, dogs come when called, but cats take a message and get back to you. And when you feed a dog, they rarely stop to sniff the food. They just kind of rush in, they chomp it up, and they're gone. Cats, every time you feed them, might be the same meal, same bowl, same place, same time every day. They're still going to sniff it before they eat it. And this is because cats' livers don't do such a good job of detoxification. So over the millennia, they have evolved the instinct to sniff the food first. And they're very amazing chemical and now analytical laboratory in their olfactory apparatus can tell if there's just a small amount of something different from what they had sniffed the day before. And if there's something different, then they get worried. It could be a toxin. So the way to work around that is to fool them by offering just a teeny amount, so small they might not even be sure it's in there, in something that they really would kill to eat. And that could even be tuna fish or whatever I mean, what what your cat will kill for. And then, maybe just continue to use that same little pinch for 3 or 4 or 5 days and then make it 2 pinches and gradually increase that so they get adapted to it. The lion's mane itself is very palatable. So it's possible that that only the most particular of cats may have issues with it. But the lions, but that's, but it's my two favorite mushrooms for cats are the lion's mane mushroom and the cordyceps mushroom. And the cordyceps mushroom helps to protect the kidneys, does have some mentation and calming benefits, but not the same benefits on cognition and these cognitive problems that we have proven lion's mane can work for. Let's see. So I mean, we have a lot more. Let's see, six. Can I add five defenders if I already give daily dog? So I created a daily dog and the functional feline now to be a kind of a once a day meal topper that would have at least the five defenders in it. It also has lion's mane and cordyceps. It has active live probiotic cultures in it and detoxification supplements. It's meant to be a once a day thing to help promote wellness. So, yes, you can use it, but I think if you have more of a disease complaint, I think it's going to be hard and not that cost effective to use higher dosages of the functional feline or five defender or daily dog in order to get therapeutically high enough amounts. So you could give the daily dog and continue to give it because it's got great probiotics and gives a good foundation for health. But then if you have a disease issue, you have a problem that you want to use a mushroom for, then I would use a more specific mushroom for that problem. The five defenders is good. It's kind of a shotgun because it's got five of the most potent immune modulating mushrooms around. But it might be a kidney issue. You might want to use cordyceps, more cordyceps on top of what's in the daily dog or the functional feline. Or you might want to use more lion's mane or, some other mushroom like maybe tremella if you've got dry skin. And tremella is a really good mushroom to use alongside of cordyceps. Tremella actually enhances hydration in the body. And with kidney disease, we find that they are dehydrated, subclinically dehydrated. So anything we can do to help the body to retain moisture that the kidneys are losing, is good there. So I mean, I can go on and on, and we'll talk about each of these different conditions in greater depth with individual meetings like these in the future. I just want to make sure I get all of these for the people that are sticking around. We've got the addresses questions at wellpethelp.com or questions at WellPet. It's WellPet Help, right? Haley, not wellpet.com. Yeah, WellPet Help is the right the first one is the right one, isn't it? These two. And yeah, we'd like to know topics. So, if you don't answer tonight, get back to us. You've got our email addresses. Um, and then Collins also says, I love real mushrooms, D2 products for human. So yeah, the mushrooms are also a great source of vitamin D. I like to take my portobello mushrooms and I put them gill side up, which is what you should do with mushrooms that you're exposing to sunlight to convert the ergosterol in them to a precursor for vitamin D2. And I'll just leave the portobello mushrooms out in the sunlight and then I'll cook with them to get my vitamin D2. But you can also use a specific product, the D2 from RX Vitamins, which uses the shiitake mushrooms that have been irradiated with ultraviolet light to convert them to vitamin D2. So it's Well Pet Help. Okay. And that address is a great address to reach me at for technical questions about your pet's health or about supplements. We have another address if you're having problems with your order. That's our customer service address. But if you send your customer service question to me at questions at Well Pet Help, I'll forward it on to customer service as well. Anyway, we try hard. We try hard to make everybody happy and keep our pets happy and healthy too. And if you don't think we're doing a good job, let us know. We'd like to know so we can do it better. And if you think we're doing a good job, let us know. We'd like to know that we're doing it right, And it's 7:30. It's about 90 minutes here. I'm ready to have some dinner. So if there is anyone else that would have any last questions, we're we're going to do cancer next. Okay, yeah, that's right. Yeah, cancer is a good topic. It's probably my best topic, quite frankly. So that'll be good. We'll do that next month.